Today we're going to talk about side effect hacks for your weight medication. If you are having nausea, vomiting, all the things, and you don't want to have that, stick around. Welcome. If you're just joining me, my name is Dr. Meghan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this channel is a place for evidence-based answers to your weight questions. So welcome. Also, side note, I'm also doing Facebook Lives, usually every week. So you guys have great questions. Sometimes I can't type a response back to all of them all at once. So if you have questions, continue to leave them. I can't answer, your personal medical questions directly, but continue to leave the questions and I'll either answer them here or I'll answer on the Facebook Live. So keep them coming. Today we're talking about side effect hacks for weight medications. One of the first ones that people have tried that I think really helps is the site of the injection. Now I'm going to say with a caveat today, this is anecdotal, okay? Usually everything is very evidence-based, but today I'm just sharing with you things that patients in my practice have tried and worked. I have not done randomized controlled studies on this, but I think it's still worth sharing. So let's talk about it. Okay, injection site changing. Sometimes, so just to take a step back, the way that the medication is supposed to be delivered for your GLP-1 agonists, your liraglutide, your semaglutide, your tirzepatide, is in the subcutaneous tissue, not in the muscle. So sometimes I find, especially if people are working out a lot, they're not getting the best effect if they're doing a thigh injection, because for some people that layer of subcutaneous tissue, the fatty tissue, is just, there's less of it compared to the muscle. So they may be delivering more of the medication into the muscle, and that's not going to give you as optimal. It's not technically how the dose is supposed to be administered. You really want to get it into the subcutaneous tissue. So for those people, I think try rotating. I mean, you don't want to inject always in the same exact site. That's super uncomfortable, but you can rotate the site around the abdomen and always, follow the safety instructions. Don't inject it near your belly button, all those things. Follow the package directions, but try different sites around the abdomen because it's just easier to get to find the subcutaneous tissue. It's easier to hold and it's often easier to inject. So if you find you're not getting, like, the weight loss isn't happening to the trajectory that you and your physician would expect, you could try that. Conversely, if you are having a ton of side effects when you inject in your abdomen, you could try injecting in your thigh for 1 to 2 weeks and see if that makes a difference as well. Okay, another one that a lot of people have is nausea and vomiting and just feeling like they don't really have much of an appetite, which is not surprising because that is how these medications work. But also we want you to be able to eat. So for those patients, I always check every visit and we go through what a patient is eating, because I do have patients every now and again, they're like, yeah, I had 3 bites of food today. That's not the goal. The goal is that you're losing weight, but you're also not malnourished. So what can we do about that? So there's a couple things. If your appetite is really, really, really suppressed on these medications, you may want to think about doing a slower taper up. So don't go up on the regular trajectory. Talk to your physician. Maybe you want to do 2 months on that dose of Wegovy or 3 months. Like, you might want to go up slower. This is for the rest of your life, so there's no rush. Like, let's just make this sustainable for you, okay? So you might want to do a slower trajectory. You also want to do small, frequent meals. It's kind of like for patients who are pregnant, like you're nauseous, but you need to eat something so the nausea doesn't get worse. So play around with that. Play around with small, bland, frequent meals and see how that works. Make sure there's some protein and make sure, I would just really try to decrease, make sure there's no like added sugar. Bland, protein, small meals, see how that works. And it might just be that your body's getting used to the medication and this goes away. But if it goes on for longer than that, that's definitely a more extended conversation with your physician in terms of, is this medication actually going to be a good fit for you? Also, this is a good time if patients, their appetite is really, really suppressed. I'm not a huge fan of protein shakes because I do feel like, you know, food comes as a nutritional package. That's how our bodies have evolved to eat it as whole and unprocessed as possible. However, I do think there is a time and a place for protein shakes, and this is probably one of them. So if you're really having a hard time getting the food down, maybe you just started, maybe you went up a dose, that might be a time where you try to incorporate a protein shake or two. Definitely some patients have fatigue with the GLP-1 agonists. That's a known side effect. Doesn't happen a lot, but also if you are not strength training, you may find that you're going to be a little more fatigued because you are losing muscle, and we don't want that to happen for you. So make sure you're eating your protein in addition to doing your strength training. And a good goal is about 1 to 1.2 grams per kilogram body weight daily. It's not a hard and fast rule, and definitely for all of these tips, like, you need to talk to your physician who's prescribing it. But that's a good ballpark number for patients, just to make sure you're getting enough protein. Also, you need to be hydrating. Water, a good goal for women is about 2.5 liters per day, and for men it's about 3 to 3.5 liters a day. That's a lot of water. So check and see how close you are to that, and that could definitely be helpful in terms of getting you through the fatigue. Some patients also find that they're having a lot of reflux, or they're burping a lot and it's really uncomfortable. So really, in addition to the small meals, you want to make sure that you are not lying down right after you eat, but also keep a food journal, because you may find that there are some patterns, especially on these medications. Maybe if you eat something that's too heavy or fatty or has dairy or has too much added sugar, you may find that it just doesn't agree with your body the way it used to. So keep a food journal and see if you notice any patterns. I know it's boring. Like, here's the thing though, like, most healthy things are boring. And that's why nobody wants to do them, but they really help. So keep a food journal and see if there's any patterns, and you can go over that with your physician who's prescribing it. Maybe this is a time for you to see a nutritionist too, if you really need to figure out like a good eating plan. That might be helpful too. That's gonna do it for today. Thank you so much for watching. As always, my references will be listed down below. No references today because this was anecdotal, but thank you so much for watching, and please be well.